that time of the week where you answer your common health questions. Joining me now, News Channel 5's medical expert, Dr. David Soria, the Chief of Emergency Medicine at Wellington Regional Medical Center. Always thank you for coming in, and we are almost in the middle of flu season right now.
We are.
Okay, a lot of parents out there obviously trying to take care of their young ones and maybe themselves. Question though, are we going to see the swine flu like we did back in 2009?
Yeah, well, fortunately, we will not. And there's a couple of reasons for that. And actually, we're getting into flu season full force. And the predominant strain this year, believe it or not, is the swine flu. There's a couple of main differences. Back in '09, if you recall, it hit disproportionately children, young adults, and pregnant women. This year, we're not seeing that. We're not going to say that we cannot, but right now, we are not. A couple other very important differences. I think we did a great job of getting the awareness out there. Yeah. Whether, for whatever reason, obviously a lot more people are getting vaccinated. So that is obviously protecting them from getting severe flu. Also, the fact is that if you were exposed back in '09 to the swine flu, you have conferred an immunity. So this year, if you're exposed again, you're not going to get it, or you're going to get a much less severe form. So it's actually been beneficial in keeping those numbers down. This year's vaccine is a trivalent vaccine. It's very effective against H1N1. So if you've gotten it, chances are you're unlikely to get infected with the H1N1. However, if you are high risk, less than 5, greater than 65, if you're pregnant, or if you have an immunocompromising disease, diabetes, or a lot of other health problems, make sure you get vaccinated. Talk to your doctor. Again, it's not too late. It takes about 2 weeks to develop immunity once you get the vaccination. So please go and get it.
I think many people can diagnose their flu-like symptoms, but how do you know if you have regular flu or the swine flu?
Yeah, you know, we get that question quite a bit, and you know what? You can't. Okay. The reality is that the symptoms are very, very similar, if not identical. The reality is you're going to have high fever. It's going to come on abruptly. You're going to have the cough, the congestion, maybe a sore throat, but you will very, very commonly have the systemic symptoms, which is fatigue, weakness, achiness, things like that. Okay. However, you can tell the difference between the flu and a cold, and that typically is very simple as well. You're not necessarily going to get a fever with a cold, but you will with the flu. And then very importantly, with the flu, you're going to have systemic symptoms. You're going to be achy, you're going to be weak, you're going to have symptoms from head to toe. With a cold, typically it's only the upper respiratory, the congestion, the sore throat, the coughing. Okay, the reality is that they're both viruses and they need to run their course, so a lot of rest, lots of fluid, and remember the principles of prevention. Wash your hands, everybody.
All right, well, if you have questions just like this, go to our website, WPTV.com, click on the health link, just scroll down to the right-hand side, and you can see a form to write your question for Dr. David Soria. Thank you for coming in. We'll see you next week.